Hey everyone, this is Grizz Ali. I'm the founder of Helix Mobile Wellness and Research. I've also taken a lead role in writing the protocol that you're about to start. I just want to thank you for joining our program, and we are very honored to have you. Over this video, I'm going to be talking about how to use the syringes within your program, an overview of the medications, and just make it very simple for you guys, because we have definitely worked hard to make this program as simplistic as possible. So pretty much all patients, men and women, are going to be getting injectable testosterone. There's going to be different ways of injecting this, different ways for women and different ways for men. So we're going to go over that really quick right now. First of all, you're going to be receiving alcohol swabs with all of your injection kits. Pretty straightforward here. You're going to open these up. You're going to have your alcohol swab. You're going to want to swab your vial, whatever in the injection vial that you're withdrawing testosterone or any other substance from. So you're going to want to swab the top of that. That's when you withdraw the substance from it into your syringe. And then take the other alcohol swab you have and swab whatever area of your body that you are injecting into. Now, if you're a man in our protocol and you're receiving injectable testosterone, which you most likely will be if you qualify, you're going to be getting this needle kit. There's going to be 3 components to this. There's going to be a syringe, and there's going to be 2 different needles. This looks a little daunting, so don't worry about it. It's actually very simple once you dive into it. But basically, you're going to take this needle, which is going to come in a package like this. So you have your needle here, has no needle, not as yet, but this is your syringe. Sorry, this is your syringe. You're going to have 2 needles here. The needles are going to have a number issued to them, and the number is in regard to the gauge of the needle. The gauge is it's a measurement of how big the opening is of the needle. So like when you inject in your skin, you want a gauge that's really high because that's a more strict opening. You're not going to feel the sensation of it as much. So basically, this is how it works. The needle with the gauge number, that's the lowest, that's the one that you're going to withdraw the testosterone or the substance with. In this case, this needle right here is a 20 gauge. That means it has a pretty generous opening. So you're going to take this 20 gauge needle. Now, when you receive your packages, the withdrawal needle, that's what we call it. This is the needle you're using to withdraw the substance. It's usually going to be a 20 gauge. It could be 22, 23 gauge, whatever is the lowest number, that's what you're withdrawing. So you're going to take this needle. You've got your needle, you've got your syringe. All you're going to do is just twist it on right there. This is going to come off. This is now the needle you use to put into your testosterone, and you start withdrawing from it, and you take the bottom end here and you literally withdraw the solution from it. Now what'll happen is while you're withdrawing, if your prescription, for example, says 0.3 twice a week, you're gonna read the numbers on this syringe right here. You're gonna see that they start with 0.1, it goes to 0.2, 0.3, 0.4, 0.5. So if it's 0.3, you're gonna be withdrawing and getting all the way to 0.3, and then that's where you're gonna stop. Now, when you stop, you're going to put this cap back on the needle, and then you're just going to twist the needle off. And your solution, your testosterone solution, is going to stay suspended right in this syringe. You're then going to take the smaller needle. In this example, this is a 27 gauge. We could be sending you a 30 gauge, a 29 gauge, it could be all the way down to 27 gauge, but the higher number is the syringe, is the needle that you're going to use to inject yourself with. So we're going to twist that needle on, and then if you look at that needle's pretty tiny. So it's got a very small opening, so you're hardly going to feel anything when you inject this. It's only ½ an inch. We never send anything that you inject yourself with that's more than ½ an inch. Really easy to negotiate. And that is what you're going to inject yourself with and then push the solution into your body. Injection sites, just a quick overview over that. For those of you who are men, actually for women as well, I tend to favor the outside area of the thigh, but you could also go all the way up to your upper thigh. You can also go into your inner thighs. We've had some patients who have done their abdomen. There is a higher potential for reaction in the abdomen, just a skin irritation. So we generally keep it with the thighs. You do want to rotate your injections. So if you inject your right thigh, you know, on Tuesday, your Thursday injection, you want to do your left thigh. Now this is the thing for the men. For those who are really adverse to needles, we do offer these 5/16 inch needles, which is, I think, like basically 1/3 of an inch. We do offer these. And if you do these though, you have to do your injection 4 times a week. Because the thing is, the smaller the needle, the lower amount of testosterone that it will really allow your body to absorb. Otherwise, you're gonna be flirting with getting bruising or some kind of skin irritation. So that gets us to, now that's the thing, if you're a man on our program and you want the smaller needle and you're okay with injecting 4 times a week, just notify your Helix concierge. We'll get you the different needles out to you and you can do it with the smaller needles. I'm gonna talk about the women's testosterone program now. For women, we don't send twist-on needles. We're gonna send 1 of 2 needles. We're either gonna send these 1/3 inch needles, or we may send you a 1/2 inch needle. Most women though are going to receive this 1/3 inch needle. Now the thing about this 1/3 inch needle, you're gonna put the same needle into the testosterone that you're gonna be putting into your body. So you're gonna get this needle into the testosterone, and the thing is, this needle, it's a little harder to get the oil in because it's an insulin syringe. So you're gonna be pumping the needle like this. So you're gonna be holding the testosterone vial and you're basically gonna be pumping it. And at some point, you're gonna start noticing that the testosterone is collecting into the needle. Now, one really important thing for women, most women, your prescription is going to be 0.05 to 0.1. Now 0.05, that makes it sound like it's 0.5. It is not. So when you look at the syringe, you're gonna see there's a 10, there's a 20, there's a 30. If you're a woman in our program and your prescription is 0.05, not 0.5, but 0.05, you're gonna fill this to the 5, which is at the very top of this needle. It's really not very much. You're gonna see a 10 here, a 10 and a 20, a 10 here at the very top. You're gonna be filling in between the 10 and the start of the needle. So you're not putting very much. Women don't need that much testosterone. We do offer it to women. It's great for women. It's excellent for longevity, but you're not putting in very much. So the women watching this video, you're literally just filling it to that 5. Same thing for the men. If your prescription is 0.10, you're filling it to 10. If it's 0.2, you're filling it to 20. 0.3, you're filling it to 30. So that's how the insulin syringes work. For add-on programs, for other injections, including HGH, peptides to increase HGH, as well as gonadorelin or B12, we've got incredible add-on programs that often come with injection. Most of those programs are gonna come with insulin needles. You're just gonna be withdrawing the solution into this needle and then using the same needle to inject yourself with. Guys, if you have any questions, if anything on this video doesn't make sense, just text our concierge and they will clarify anything. The last thing we're gonna go over real briefly, all patients receive a morning solution and a nighttime solution. Our nighttime solution is our HGH sleep formula. It's a proprietary sleep formula that enhances HGH as well as helps rebuild mitochondria within your body. It's excellent. That'll come in 2 forms. Some of you will get it in an MCT bottle like this. Usually that's blue. For those of you who have an MCT bottle solution of this, you're gonna shake this vigorously anytime before use. And then you're gonna fill up the MCT oil here. What you're gonna notice within the MCT oil is there's little numbers right here on the plunger. For your nighttime solution, you're gonna fill this up to 0.5. That's the prescription that most patients are gonna get. You're gonna fill this to 0.5. You're gonna put that under your tongue and you're gonna drop 0.5 of that MCT oil under your tongue. You wanna keep that there suspended under your tongue probably for at least 1 minute. At least 1 minute. Could be 2 minutes. 2 minutes might even be better. But for at least 1 minute, keep that under your tongue. Let it swash between your teeth, under your tongue. You're getting it into your gums. It's going right into your bloodstream, which is great. And this has peptides in it to help create HGH within your body. It's also got amino acids that are going to help you sleep, as well as help rebuild mitochondria. It's an incredible solution. You can swallow the solution, or you can actually spit it out. So if you don't like the taste, you can spit it out after it's been in your mouth for a minute. The morning solution is gonna come in a more clear frosted vial like this. Your morning solution is 4 times a week, not 7, that's too much. So 4 times a week, you're gonna be using this morning solution first thing in the morning. You're just gonna shake it vigorously. This one, same instructions. You're gonna be filling it up to the 0.5, halfway, dropping that under your tongue, letting that sit suspended under your tongue for I would say 1 minute. This one I would recommend you swallow. I wouldn't spit this one out. This one I do recommend you swallow. And lastly, for the patients who don't receive MCT oil, some of you will receive Troches. They come in a package like this. Most of our Troches, you'll want to read your patient directions. Most of them you're going to be cutting into 4ths or 1/8. So you'll literally be taking a Troche. It's kind of the size of a quarter. You'll be taking a Troche like this. And I highly recommend going to Walgreens and buying a straight blade. So this is a straight blade. I'm keeping the cover on though. I don't want to cut myself. But you want to take a knife or a straight blade. You're going to cut this Troche into 4ths, sometimes into 1/8. So what that means is you'll cut it into 4 and then cut those pieces into half. And then the Troche piece, you're literally going to take that 1/8 or 1/4 dosage, put it under your tongue, and you're going to let it dissolve. And what I would do is when you cut the Troche, the extra pieces, I would just put them in this same packaging, and then it's a pretty easy package to hold on to. But for those of you who don't get MCT oil, you will get Troches, 1 set for the morning, 1 set for the night. The nighttime is our proprietary HGH sleep formula that I already covered. Our morning one is incredible. It includes pregnenolone, it includes oxytocin, so it includes hormone ingredients that are gonna reduce your anxiety, reduce your stress, but also give you some boost, some extra focus, hopefully an energy boost as well, to go out and conquer your day. We also send a medication guide covering this. Like I said, guys, if you have any questions, text our concierge, reach out to our concierge. They will be happy to answer any questions that you have. Again, this is Griz Ali. I am the founder of Helix Mobile Wellness and Research. We are always honored when anyone entrusts us with their care. And I hope you have a wonderful experience. Any issues, any concerns, do not hesitate to contact your concierge. That's what we are there for. Thank you so much for your time.